it's a little bit late. I am 37 weeks now, which means early term, but I'm actually almost 38 weeks, and by the time you see this, it will be 38 weeks. It's been a very eventful week. So what used to be relatively good blood pressure with a few random high readings has now turned into officially a hypertension. It's always high now, every time, and sometimes extremely high. Starting with my appointment on Monday, the first reading was 143 over 104 or something like that. Not good. And there was trace protein in my urine as well, which my doctor was not concerned about that per se, but I did like it a lot better when there was none at all. But he was a little bit worried about the blood pressure, and of course he wanted that checked again on the way out. He did check my cervix. Ordinarily, I probably would have skipped it, at least this early on, but since the blood pressure has been misbehaving, and I knew that having a favorable cervix is important to him for induction to be an option, I was curious just to see where it was at. And it is, actually. It was 2 centimeters dilated and 75% effaced, but she is not quite low yet. She was at -2 station, so she's floating a little bit still. So he'd prefer to see her drop down lower for an even more favorable setup for an induction, but it's not bad for 37 weeks. And I calculated out my Bishop score. As far as I can tell, she's facing anterior when I feel around. So I have a Bishop score of 8, which is like the minimum recommended for a successful induction, so at least it's decent. So on the way out, took my blood pressure again, and this time it was 135 over 107. So that diastolic was not good, because over 110 is considered like a crisis, like dangerous levels. Yeah, so we waited forever for them to tell him what the results were, because he was busy with other patients, and we finally ran into him, and I actually ran into him before the nurse did. So then he sat me down and personally did it again, and that one was 130 something over 96, I can't remember, and it was still not good, but it was a little bit better. So he told me he wanted me to go to the store the next morning and take my blood pressure reading, and he said if it was over 100 on the diastolic that he would want to put me on medicine. So the next morning, took Justin to work, and then Kaladin and I went to Walmart on the way home, and it was 153 over 98. So I'm like, okay, it's not above 100, but being over 150 is also not good. So I called the office and told the nurse, and she said she would talk to him and call me back. So a little bit later, they called me back and they said, yes, he wants to put you on the medication. So I'm on, it's called labetalol. It's the one most commonly used for an antihypertensive. And she also told me that he wanted to schedule a blood pressure check and non-stress test for that Friday, which was today, with Dr. LaRose, which is the other doctor in the office that I originally started with and switched from because Dr. Andrews was out of town today. So I went in for that this morning. My appointment was at 11:30. I was there by myself, by the way, so there's absolutely no influence from Kaladin. Took my blood pressure, 166 over 99. Just not good. Over 160 is very bad. Then we did the NST, and at first she was sleeping, so she wasn't moving, and her heart rate was staying right around the 130 baseline. So he came in a couple times to check, and he's like, oh, we'll do it a little longer, oh, we'll do it longer. And then he busted out the little buzzer thing to wake her up, and that did the trick. So then she started moving, and her heart rate was going up into the 150s and whatnot, so then he was happy with that. So she did pass. The NST is reactive, which is good, so at least for the time being she's doing alright. So now we're just worried about me. So I've been feeling a little dizzy today. I was seeing some spots a little bit during the NST, which was the first time that's happened, and I'm still pretty swollen. My feet and ankles are more swollen than they've been so far. So he asked me, he's like, so has Dr. Andrews talked about delivery? And he said it like with this like look of glee on his face a little bit. I was like, well, no, he hasn't, not yet. He's like, oh, so he was waiting for you to go into labor? And I was like, well, that's been the plan so far. You know, the blood pressure's only been a problem this week. He said to lay down as much as possible, so basically modified bed rest this weekend. I have my appointment with Dr. Andrews on Tuesday. He's pretty convinced that Dr. Andrews will be talking about delivery when I see him on Tuesday. Hopefully it's just that there hasn't been enough time for the medicine to help yet. Hopefully, since it'll be another few days, it'll give it a chance to start helping. Ideally, I would like at least one more week to wait for her to come for a couple of reasons. One being we're still not 100% ready, and with me having to take it really easy this weekend, it's gonna be hard for us to be. But I'm gonna try, because Tuesday might be the day. We have some like scheduling conflicts, like, you know, over this weekend Dr. Andrews is not in town. I would really like it to be him to deliver the baby. My birth photographer is going to be out of town Tuesday the 27th through the 29th, and then Justin has his PRT with the Navy, which is the physical fitness test, on Friday. And that's in the morning, but then they also are having like this big picnic in the afternoon that he wanted to go to. So, you know, we ideally would like it to be, you know, next Friday afternoon at the earliest. And then also Saturday, the 31st, is when I'll be 39 weeks, which will then make her full term. Aside from all those other reasons, which are not as big of a deal, that's kind of a big one. I mean, 38 weeks, most babies still fare pretty well, but, you know, for it to be a better chance that she'll do well is 39 weeks or later, which is the whole reason ACOG changed the guidelines for what term means and redefined it. Hopefully things will be okay enough that we can wait it out another week. But I do trust Dr. Andrews. He is very hands-off if things are okay to be hands-off about. So if he is very concerned and doesn't want to wait that long, then I trust his judgment, and we'll just have to make do. And I guess I just won't have a birth photographer there, which kind of sucks, but it will. So I have my hospital bags pretty much ready to go, with the exception of some of the last minute stuff, and even some of that I think I can get done over this weekend. So I just want to go over what was in that for you guys. Alright, so I've got my checklist here. So this is my bag. It's this really cool Tinkerbell bag. Small pocket. I have a couple pairs of the cloth breast pads. I have makeup remover, a toothbrush and toothpaste, some floss, deodorant, some clippers and a nail file, and my Scarlett's chapstick. It's strawberry flavor. When I went on the labor and delivery tour, it was really warm in there, so I decided to pack a fan. This one is cool because you can use it with batteries as well, so that we don't have to worry about there being an outlet and it reaching or whatnot. I have my shampoo and body wash, some nipple cream, and this is the baby wash for the baby. We use this brand with Caledon as well. He has very sensitive skin. This is Cucumber Melon scent. It smells so good. But this is Scarlett's Naturals, which is the same brand of the chapstick, and it's the brand we also use for sunscreen and bug spray. I have a big old thing of honey sticks. There's all kinds of flavors in here. So these are great. So if you need a little bit of an energy boost, but it's not real heavy, like food, like if you're not quite hungry. A couple of Cliff Bars. I have a bikini top in case I go either in the shower or if I get the room with the tub. I have some disposable breast pads. I got one thing, depends, and a couple of pads. I know they usually provide the pads, but just in case I don't like them, they're usually really bulky. Depends will probably be for when I go home. People swear by these, say that it's like a way more comfortable way to, you know, take care of that whole postpartum bleeding issue. I've got my makeup bag. Quick reference guide. There's also a page that you put on the door, and like a little thing you give to your nurse to kind of explain how to help with a hypnobased birth. And I made some copies of some of the manuscripts so that they can each being Justin and Rebecca, my doula. I have also my birth plan, or I call them birth preferences because I am flexible. So there's one that's front and back that I need to bring to my next appointment and have him sign it, because some of the things that I'd like the hospital's okay with as long as there's physician approval. So if his signature's on it, then it shows them that he's okay with it, because like he's okay with me eating whatever I want, he just doesn't think I should eat something heavy. But the hospital will only let you have ice unless the doctor said you can have, you know, other things. So, you know, I have that for him. I brought it to my last appointment and I forgot to mention it. I also have 2 copies of like the longer, more detailed version. So one for Rebecca, one for Justin. And then I have a shorter 1-page version that's quick to look at, and I have 3 copies of that. So for any nurses or any other like on-call doctors or whatever to be able to look it over. And then I have a separate page in case of cesarean. And so this reiterates the newborn procedure stuff at the bottom, since that'll be, you know, a separate place. So I have 3 copies of that as well. So it would be like OB, anesthesiologist, nurse. And then I've got, these are the wipes for Squish that I'm going to have to put in my bag because hers is too small. So a couple more things that are last minute that I haven't put in there yet. Socks, like hair bands, comfy clothes. I'm planning on putting in a nursing tank and a maternity, like those fold over skirts that are really super comfortable. I'll probably end up wearing the hospital gown anyway because that's what I did last time, but just in case I'll have that comfortable outfit. Coming home outfit I have to put in, I think I'm going to use a dress. A nursing bra to wear with that, and my brush. I'm going back and forth about if I want to pack a razor or not. We'll see. Probably will, just in case. I'm going to bring a towel because the hospital towels usually suck. And I'm also going to put a towel in the car just in case my water is already broken or it breaks on the way. A robe. And then the laptop and the charger will obviously be last minute, as well as a charger for my iPhone. But I do have my camera bag ready, which is here. And this has my digital SLR camera and our little video camera and chargers for both, and memory cards. We're going to set up a bag for Justin. He's not going to need much because now that we have Cal, he's obviously not going to be spending the night there the whole time with me. He'll still be coming back and forth to home. So for him, his phone charger, I also have a tablet and the charger for that, a swim trunks in case, again, tub or shower and he wants to get in with me, change of shirt, deodorant, change for the vending machine, For Kaladin, I'm using my usual diaper bag, which is this. It's a Jujube BFF, and I love it. It's amazing. Since he's going to need more stuff, I'm using a bigger one for him. So in here, I'm basically packing it for either scenario, either if he's with us or he's going to go to my friend's house, so that he's covered no matter what. I have these 2 books I got for him to tell him that they're his present from his baby sister, and that'll be adorable. I have wipes. I have diapers. So these are the ones we usually use overnight. They're Huggies overnights. And these are the brand the commissary has, which I like because he's not allergic to these and they're inexpensive. I just figured it would be easier to use disposables either way. And then I have jammies. They're so cute. This little whale nautical theme. So jammies just in case. Also gonna put in a change of clothes just in case. And a change of shoes just in case. Obviously some snacks in his sippy cup. Maybe a couple toys. I got a thing of Color Wonder because he likes to color. And Spotsworth is his little stuffed giraffe, which is his little like comfort thing. Lastly, for Squish, I'm using our smaller diaper bag for her because her stuff doesn't take up as much room, but it is totally full. So here in the front is a wet bag, and then I've got a headband. I've got this one and a white one that's the same to go with her going home outfit. There's this CJ's Spritz. So this is like a nice like preventative for diaper rash, and it also smells amazing. And then this is like the butter. This is a trial size in case she needs something thicker. And on this side, we have the pacifiers. These are the MAM. It was Kaladin's favorite brand. And a clip for it. And socks. A few of the 7th generation disposables. I know the hospitals usually provide them, but they're usually size 1 diapers, and they're usually Pampers, which is not my favorite. So I would just like prefer to use the kind that we like, especially if she ends up being allergic to certain ones like Cal was. I also brought some cloth too, so we'll see. I mean, it depends on how long we're going to stay there for. If I end up with a surgery and we're going to be there for longer, then I might want to do disposables more so. But we'll see. So I have a couple of pre-folds, newborn size. I have a couple of covers. And then I also have a couple of the all-in-ones. This one too. I decided to do the charcoal inner ones so that, you know, with meconium, it won't, if it does stain, you can't really tell. And then on the pre-folds, you can use bleach on those and you get it out easily, just in case. Although people say they didn't have trouble getting meconium out, just in case, you know, just easier. You know, last time they provided a shirt at the hospital, and a lot of times I just had him in nothing but a diaper to hold him skin to skin for pretty much the entire time we were there. So it might go that way again, but just in case, I've got a newborn size. This is Gerber, which are the tiny ones. So just in case, I have a 0 to 3, which is this one. For going home, I have a couple options. This is the one I really want to use. Just the little anchor dress with the, just in case it's too small. I also have this one, which is newborn, but is a little bit bigger. And I have shoes that will match this. I need to find them again. And then if she's really big, this is a 0 to 3 outfit. So one of those she will come home in. Then obviously her car seat will be in the car. I'm also going to bring 2 receiving blankets to roll up and put on either side of her head. and a muslin blanket to drape over her if need be. And one last bag is going to be the snack bag. I have some hard candies, mostly for me, but I also share those with the nurses. I got a few different bags of like chocolates and candies and things for the nurses. I'm also packing a bunch of snacks, mostly for Justin and also for after I have the baby, you know, in between meal times, because you get so hungry when you're nursing. But also some of the things are lighter, where they're the kind of things that I might want to eat during labor if I get hungry. So I've got some like Jello cups, some pudding cups, some like fruit cups like mandarin oranges and diced peaches. I'm gonna also probably bring along some fruit like grapes or bananas. I've got chocolate covered pretzels, trail mix, peanut butter crackers, goldfish crackers, those are mostly for Cal, craisins, beef jerky, I've got those little things that come with crackers and then some like tuna salad to put on them, and Gatorade. But yeah, we're pretty much done. Bring the puppy as well. I prefer the My Breast Friend pillow for nursing, but the Poppy is a little bit more versatile for labor and delivery as well, so that's what I bring to the hospital. And I'm also, speaking of labor and delivery, I'm bringing my birth ball. It's really an exercise ball, but my birth ball, because the hospital does not provide any. Other than that, my doula has her own kit of stuff. So there you have it. That's the stuff I'm bringing with us. So I am feeling relieved that I have that out of the way, because I'm more prepared in that regard this time than it was last time. The car seat, I have it all cleaned up, so I just need to install that at some point this weekend, and that'll be ready to go. I have the rocking plate cleaned up and ready to go, so that's what we assume she will sleep in. I also need to clean up the co-sleeper just in case that needs to be what she sleeps in. We're almost ready for her, and that's just yikes. I just can't believe it's almost time. Like, it's really gonna be very soon. I mean, ordinarily it could be a whole month away still, but you know, because in light of this blood pressure thing, I really don't think that he's gonna want to wait quite that long, and in fact I don't even know if I'm gonna make it to the due date. So I would imagine probably within the next week or so, 2 weeks probably tops, we're gonna meet her, and that's exciting and kind of scary all at once. I mean, induction is definitely not ideal. I definitely was not wanting to go down that road again, but it is there for a reason. There are medical reasons, and it is very helpful for her. This is one of those times, and honestly, with my experience with Caledon, it wasn't the induction so much that was so terrible. I mean, it makes it hurt a little more and stuff, but I was doing fine with that part of it. It was the rest of what happened that was so difficult and traumatic for me, and I don't foresee it going down like that again this time with the doctor that I have, or at least now I know, like on my birth plan, you know, what things specifically to ask for. I plan to hopefully have another bump date posted before the time comes, but that might not be possible if he does send me over to the hospital on Tuesday after my appointment, because I really won't have anything else to update between now and then to make one prior to that. I'll try to maybe make a quick one and post it from the hospital at the beginning of the process when, you know, it's not so bad. We'll see, but hopefully we'll be able to wait a little bit longer, and then I will definitely have time to make one more update. But anyways, one way or another, until next time guys, bye!